Welcome back, and in this video we discuss yet another very important topic from the shoulder complex biomechanics, that is the dynamic stabilization of the glenohumeral joint. So far we have discussed the static stabilization, and I think that you are pretty thorough with that. And now we discuss about the dynamic stabilization of the shoulder complex. It is in fact a very crucial topic like the static stabilization in a professional or in your academic life. And let us pay the maximum attention and learn this in the most simplified manner possible. You know pretty well that dynamic stabilization means stabilization during the movement of the arm or stabilization during motion, and static stabilization is stabilization at rest or relatively in equilibrium, right? And thus static stabilization we learned as a story, and dynamic stabilization also we will try to learn it in such an interesting manner. And here we have in dynamic stabilization four important players or four important characters. Since it is a four character story, it's going to be a bit more vast than the static stabilization, but I promise you that this is more fun to learn than dynamic static stabilization. So the four important players or four important factors that you need to consider in dynamic stabilization are: first one, the deltoid muscle and the dynamic stabilization, right? The second one, can you just name it? The rotator cuff muscles and the dynamic stabilization, right? Yes. The third one is the supraspinatus and the dynamic stabilization. And the last one is long head of biceps brachii biceps brachii, BB, biceps brachii and dynamic stabilization. But let me ask you, isn't supraspinatus one among the rotator cuff muscle? Why should we consider it separate? Want to know the answer? Stay tuned with this video towards the end. And here we go with discovering the role of the first character in our story, that is the deltoid. What do you know about deltoid? I just want to ask you. Let us just make it an interactive one. What do you know about deltoid? It is a muscle. No, not that. It is a prime mover. You know that it is a large muscle capable of producing a large amount of force. And I think that you already know that the deltoid is in fact made up of three fibers. This is how you see the deltoid muscle, okay? A relatively quadrangular shaped, and you have three fibers. I think that you know. One is the anterior fiber and middle fiber and the posterior fiber. This is the anterior fiber. Here you have the middle one, and here you have the posterior fibers. Together that they makes the deltoid muscle a very large bulky muscle that you see in your side of your arm, right? So, and we know that deltoid is made up of three fibers, right? We know that deltoid is a prime mover. Okay, deltoid is capable of producing shoulder flexion, abduction, etc. Right? So let us expand our knowledge in biomechanical way. That was just anatomical function and shape of this muscle. But what is the difference, or do we have any difference in deltoid rod if we take it biomechanically? So we need to draw a shoulder complex, right? So for example, we have here our humeral head like this, right? Okay, and you have the glenoid fossa and associated structures. And how do you see the deltoid one? You see the deltoid muscle running like this. Okay, here you have the deltoid muscle. Okay, here you have the deltoid muscle. Yes, up to the deltoid tuberosity. Yes. Okay, now for our understanding, we know that three fibers are there for the deltoid: anterior, middle and posterior. But we can consider these three individual fibers into one single fiber when we are considering deltoid muscle as a whole, or the force directed or produced by each of this muscle can coincide or will coincide with the middle fiber when we consider the muscle as a whole. So we have a force vector that is produced by the anterior fiber we have it by the middle fiber, we have it by the posterior fiber, but completely we can consider it as a force produced by the middle one, or the force of anterior, middle and posterior will sum up to be the force of the middle one, or in the direction of the force of middle one. So how do you draw it? We can draw it in this direction. How do we draw it? The fiber of a middle one, from this point of application, let this be the force produced by deltoid. How do you call the force produced by deltoid? FD or F deltoid. So this is the force produced by the deltoid muscle. And now we have studied earlier in our first classes that any force vector can be, for example, if this is a force vector or if this is a force, you can divide it into two components. You can divide it into two components, a parallel and a perpendicular component. Of course, the Fx component and Fy component, right? We can divide it into a perpendicular component and a parallel component known as the Fx and Fy components. Okay, that is simply, you just have to understand that if you have a force line like this, you just have a line, you can just draw a perpendicular one and you can just draw a parallel one, and both of them becomes the Fx and Fy component of that force vector, just that much only. So in case of deltoid also, we have a parallel component and a perpendicular component, because deltoid is a force vector. The F deltoid is a force vector. So how do you divide it? This becomes the parallel component Fex, and here we have the perpendicular component Fy. Okay, we have the perpendicular component Fy. That is simply, you just draw two lines for the deltoid force, just that much only. No need to get confused with mathematics or physics. Okay, now we draw Fx and Fy for the deltoid. I don't want you to think with the Fx, Fy, something like that. I just want to think, can you just look at these two forces and say these two lines, one is the line like this and another line this one. Okay, can you just look at both these lines and just interpret the result? Can you just analyze what is the difference between these lines? Simply you can see that the Fx component, or this line which is parallel to the force of the deltoid, is much larger than that of this component. Okay, that is our conclusion. We see that the line of this one is very small as compared to, very large as compared to the line of or magnitude of this Fy. That means we arrive at a conclusion that the Fx component of the deltoid is very large than the Fy component. Fx component of the deltoid, or the parallel component of the deltoid, is greater than that of the perpendicular component Fy of the deltoid. That is one scenario. Now you need to relate this mathematical and physics knowledge into the biomechanics. How do we do that? So just imagine a situation, or just think that we know that the glenohumeral joint, this is the glenohumeral joint, and you know that the humeral head is not encompassed or not covered completely inside the glenoid fossa. In fact, it is just resting like this. The glenoid fossa and humeral head is having an incongruent articulation, and humeral head can translate superior, inferior, slightly anterior, posterior, medial and lateral. Such translations are possible. Now just remember that the humeral head can translate in that direction. And now just take it this consideration. Now arm is at side. For example, my arm is at side. Okay, this is the scenario when arm is at side. Now my deltoid is trying to produce a contraction. So my deltoid will try to produce the contraction for abduction. Okay, for abduction, deltoid is trying to produce the contraction. But what will happen when the deltoid will contract? If the deltoid contract isolatedly, it will produce two type of force. One is a superior directed one is a lateral directed one. What is the nature of the force? Superior is very large as compared to the lateral directed one, right? So what happens here? The superior one will produce some motion. What type of motion can it produce? Superior one will produce some motion. What type of motion can it produce? It will produce the superior translation of the humeral head. So instead of moving the humeral head in lateral direction, that is the abduction, the force of the deltoid will produce its predominant motion. That will deltoid will pull or push the arm humeral head superiorly. If instead of moving this laterally, this is not the exact way to hold this one. This should be like this, okay? Just forget that and come to the idea. So instead of moving this laterally, what happens if the humeral head is translating superiorly? It will not go up to the coracoacromilan and arch and get impinged. That is a painful one, so don't think about that. Just that the lateral movement or the abduction will be minimized or restricted because we have a superior motion which is predominant. So earlier we saw that our deltoid is capable of producing or is a prime mover, but now I came to inform you that, or now we came to the conclusion that the force produced by the deltoid, F deltoid, when we divide it into the force component, or simply we need to think about like that, if the force deltoid produced by the deltoid will produce a superior translation of the humeral head instead of producing the lateral translation, lateral movement or abduction. That means if the deltoid is going to act alone, it will not be capable of producing the abduction, but instead it will result in producing an unnecessary and unwanted force or movement, that is a superior translation. We don't want that superior translation to happen. We want deltoid to work to produce the abduction. You want to succeed in examination with 80% mark, but you come up with sometimes a 60%. Something is wrong or some extra work is to be done. Similar to that, we don't want deltoid to produce superior translation. We want abduction. We want flexion to happen, but it's not happening. Here what happens is a superior translation. So in nutshell we can say that the force produced by the deltoid, instead of producing the necessary and wanted movement known as the abduction or any movement, it ends up in producing superior translation. Now you can simply tell me that, sir, we have the force vector of the gravity Fd or Fg, okay, and it can offset the force of the deltoid. No, it won't be able to produce or offset the high amount of force produced by 3 fibers of the deltoid. You should remember that deltoid is made up of this one, this one, this one. So such a large amount of force is produced and gravity cannot offset that. So it's not balanced. It's not balanced, and you cannot depend upon the gravity to balance that superior translation produced by the deltoid. Clear? Okay, and one more thing I want to just inform you that, for example, let us just consider it's a ball and socket joint, which one? Glenohumeral. Similarly, we have the acetabulum and the hip bone to be a ball and socket joint, but here is the head of the femur. Okay, here is the head of the femur, and just imagine this situation here. Just do not look at the beauty of my diagram. If the same scenario is existing here, Fx and Fy. Okay, sorry, Fx, Fy and Fx, okay, whatever it is. See this force, what is the direction of the force? It is superior, but can it produce a superior translation? Can it create a instability in the joint? No, because this force is directly into the joint cavity. But what is the problem in glenohumeral joint? This humeral head or glenoid fossa is not in line like this. It is in this direction itself. It is in a lateral direction to the head of the humerus, and head of the humerus is not situated like this to the glenoid fossa. If it is situated like this, this force could have produced the joint compression and it would have produced stability, and stability, if there is a stability, similarly the Fy component can produce the abduction. But here the force line or the humeral head is not into the fossa. Humeral head is situated like this. Our fossa is here, and it would tell the glenoid fossa, if you want some stabilization, come to me. There is nothing like a complete into articulation. They are just sitting like this. So to produce this force, this should be minimized. This should be, if this is minimized, deltoid can definitely produce the action. So I'm not telling that a deltoid is an incapable muscle, but deltoid has a disadvantage that it is sitting, its line of action is in such a way that it produces superior translation instead of joint compression. If that superior translation is directed in a way of joint compression, definitely this movement would have take place, this is the abduction, would have taken place in the most beautiful manner, but that's not possible. So we need some mechanism which should balance the superior translation of the deltoid. Clear? And we are in search of that. In search of that, we find out the second character in our story, that is the rotator cuff muscle. What is that? That is a rotator cuff muscle. Let us just look into that. Can the rotator cuff muscle help us in providing a solution to the superior translation of the deltoid muscle? And rotator cuff in turn is made up of supraspinatus, infraspinatus, subscapularis and teres minor. You know that. In these muscles, the itis muscle, what is that? It's not a sits muscle. Supraspinatus, infraspinatus, teres minor and subscapularis. In these muscles, the itis, infra, teres and the subscapularis are together known as the itis muscle. We are considering those muscles in our discussion. Why? That is because if this is the scapula, you know that here is the infraspinatus, just below the infraspinous fossa. Here is the subscapularis and here is the teres. Okay, but supraspinatus is up above the supraspinous fossa or the spine of the scapula in this manner. So the line of action of these muscles, one is in this manner and another is, three of them are in this place, just below that muscle. So we will consider these three muscles together and later on we will consider the supraspinatus. That is why we don't consider supraspinatus along with the rotator cuff. And there is another one more reason which you will find when we discuss supraspinatus. So let us take the same example. We have the humeral head like this. We have the glenoid fossa in this direction. And of course here you have the spine of the scapula, which you don't have to worry about. And you have which muscles? The subscapularis, infraspinatus and teres. Three of these muscles are located in this manner, right? Three of these muscles are located in this manner. Which is the line of pull of these muscles? What is the line of pull of these three muscles? These muscles will be inserted into here and these muscles will pull the humeral head like this, or the action line of this muscle will be in this direction. The action line of these muscles will be in that direction. So now if we imagine itis muscle, ITS, we can consider these three muscles either individually or completely as one set. We will consider it as one set. So this is the force produced by itis muscle, F itis. The same scenario here, you can divide it into Fx and an Fy component. You can divide it into an Fx and an Fy component. Let us just divide it. Okay, when we divide it into an Fx and Fy component, this is the parallel component Fx and the perpendicular component Fx. Okay, Fy and Fx. Can you just see the beautiful picture over here? Can you just see the beautiful picture? Here also Fy is greater than the Fx component. Here also Fy is greater than the Fx component. Can you just look at it and tell me what can you interpret from this diagram? Just think about it at 30 seconds. Which is the largest amount of larger magnitude force? That is a Fy. What is its direction? The Fy is into the joint cavity. Fy is into the joint cavity, or simply if you look at it in this manner, this force is into the joint cavity. That means it will compress the humeral head into the joint cavity. It will compress the humeral head into joint cavity. If it is compressing the humeral head, what is it producing? It is producing stability to the humeral head. It is producing stability to the humeral head. That means it is providing a compressive force which is going to stabilize the joint. For motion to take place, first stability has to be achieved. For motion to take place, first we need to have stability. So here the stability is achieved by the action of itis muscle. So that will produce the stability. So that will produce the stability itis. Now, so this stability Fy component will help in the motion of the humeral head. So this component, instead of producing the abduction alone, it is producing throughout the abduction a force directed into the joint cavity. A force directed into the joint cavity, that is stabilizing. That means throughout the motion there is stability also achieved. That is, it is providing a force which is providing the mobility as well as stability. Now, we were in search of something that can balance the deltoid's force, Fx component. Okay, we were in search and we got a component here. You see, we got a component here, Fx, in the same direction but same magnitude but opposite in direction. That means the superior translation, which was a drawback of the deltoid, will be balanced by the Fx component of the rotator cuff muscle. So what happens in the total picture? We combine the story with the deltoid and the rotator cuff. The deltoid is capable of producing abduction force. The rotator cuff is also capable of producing such a force, but deltoid has a drawback of producing superior translation, and its drawback is being balanced by its counterpart, that is the rotator cuff. So ultimately we don't have a superior translatory force which can be a problem for us. We don't have a superior translatory force which can be a problem for us. So the story of the rotator cuff muscles is, we consider the itis muscle, infraspinatus teres and the subscapularis together, and we see that the line of action is in towards the joint cavity. Now we divide it into two components, Fy and Fx component, and at the end of the division we can interpret that the Fy component is producing the motion as well as directed into the joint cavity. That is what we are focused on, more focused on. That is what we should more focus on. That is, it is directed into the joint cavity, whereas its Fx component is directed downwards, which is exactly opposite to the force produced by Fx of the deltoid. So these two will balance each other. So ultimately you have an Fy into the joint cavity which produces stability. At the end of the picture, we get a directed component into the joint cavity and a balanced component of this deltoid's superior translation, which was a disadvantage. So at the end of the picture, you can just forget about every other component and let us just look into the force produced by the deltoid and the rotator cuff alone. We know that the force produced by deltoid is F deltoid is in this direction, and force produced by infraspinatus and teres minor and the subscapularis is in the direction, that is Fd and Fit. What you see in these two direction forces, this act as like a force couple. There is a force couple acting over here which is going to produce a completely pure rotatory movement, which is capable of producing some completely pure rotatory movement. One is directed upwards, one is directed downwards, one has a component downwards, one has a component upwards, and ultimately you have a pure rotation without any or minimal translation. That is the role played by infraspinatus and deltoid. Clear? So you can summarize your discussion with the infraspinatus, stating that it is providing a balance or nullifying the superior translatory force of the deltoid. And now we move on to see the next muscle in this group, that is your supraspinatus. What is the role played by supraspinatus and why is it special? Why is it special? Okay, throughout in your rehabilitation discussion, you see that we focus a lot on the supraspinatus rather than any other muscles. That is because of the greatest role played by that muscle. So just imagine this is a picture of the supraspinatus acting. We have the supraspinatus fossa. Now we see that this is the supraspinatus, and if we divide it, if you look into the direction line of pull of this muscle, we see that the line of pull of supraspinatus is in this direction. That is how the supraspinatus is going to active. The same technique of resolving, when we resolve it, we see that we have a component like this and we have another component in this direction. This is a very small component as compared to this component. This is the Fy component and this is the perpendicular Fx component. So can you just look at this picture and tell me again one more conclusion. Look at these two diagrams. One is this direction and this direction. What is happening over there? you see that this component, Fy component of the supraspinatus, is very large as compared to the Fy component. That means the supraspinatus is capable of producing a joint compressive force. The supraspinatus is also capable of producing a joint compressive force. At the same time, it has a disadvantage that it has an FX component which is superiorly directed. This FX is very small, thus it will be balanced by the gravity. This will be balanced by the gravity, not the deltoid force, but the supraspinatus, since it's a single muscle, that force will be balanced by the F gravity. So you don't have to worry about that picture again. But you have to think about the Fy component. Even though the supraspinatus is a superiorly located one and it has an FX component which is disadvantageous, still we consider supraspinatus as a very important mover of abduction. In fact, supraspinatus can alone move the abduction theoretically. Why? That is because, can you just look at this direction? How large is the momentum of this supraspinatus? The line of action is resting away from the joint axis like this. So such a large momentum for this muscle will increase the efficiency of this muscle. Something that you see with the infraspinatus or the itis muscle. But in supraspinatus, you have a very large momentum, not like that of the deltoid, and as a result, the line of action of this muscle or the force producing capability of this muscle adds on. That means the efficiency of this muscle increases because of this greater line of pull. This greater line of pull will increase the efficiency of this muscle. So that is why, even though it has a superiorly located translatory component, supraspinatus works more efficiently than the deltoid or other muscles in producing the motion. Because why? That is because it has a component which provides a compression. So it compresses the joint. So stability is achieved. Now it can freely move the joint. It can move the joint without superior translation, because superior translation is balanced by the gravity. But it's such a large momentum, it's going to create efficiency for the muscle, or will help the muscle to produce more amount of force with less muscle activation. That is why we consider supraspinatus as a very important mover of abduction or the glenohumeral joint. So what do you conclude by the story of the supraspinatus? The supraspinatus acts to produce a joint compressive force. At the same time, it has a superior translation, a very minimal superior translation, which is in fact balanced by our gravity. So the superior translation is not a problem because it is balanced by the gravity. So the humeral head do not go upwards. Now focusing on the perpendicular, the component Fy, we see that it is directed into the joint cavity and can produce the compression, at the same time can produce the movement. Even though there is a disadvantage for the supraspinatus, it is more advantageous than the other muscles because it has a very large momentum, and because the line of action is further away from the joint cavity or joint axis than the other muscles. So the efficiency of the supraspinatus increases, and as a result, supraspinatus can produce the movement even alone in case of dynamic stabilization of the shoulder complex. And finally, we move on to the last muscle in this complex which can produce some sort of movement, is your biceps brachii muscle. What is the role played by biceps brachii muscle? What is the role played by biceps? It is to be noted that the role played by the biceps brachii is controversial and a very minimal role, but definitely it has some capability to produce the dynamic stabilization, because you know that it is active in shoulder flexion movement because the long head is inserted into the supraglenoid tubercle and superior labrum. Now let us see that we have our biceps brachii muscle. Its long head is passing on like this, and it passes through the bicipital groove, just through the tunnel formed by the bicipital groove. And of course you have a ligament here, the transverse humeral ligament, which is going to stabilize it. You don't have to worry about any of those things. You don't have to worry about the anatomy. Just remember that the long head of biceps brachii passes through an osseous tunnel through the bicipital groove and the ligament, and then just it passes on like this. It passes on like this, and here we have the capsule of the glenohumeral joint is there, okay, in this direction. And what happens is that it pierces the capsule through an opening in the supraspinatus and the subscapularis. It pierces the capsule, and then just go to insert into the superior glenoid labrum and superior capsule. Okay, now you see that the long head of the biceps brachii is in fact related to the supraspinatus subscapularis, that is our rotator cuff muscle, as well as it is related to the superior capsule and the associated ligaments. So what can happen is that this long head can produce some role in the glenoid humeral stabilization. What is that? The very simple rod. Can you just look at this diagram? This is like the long head is like a rod or like a tie, okay, which link the humeral head into the fossa. That means this wire or this line or this rod can help in centering the glenoid fossa, centering the humeral head into the glenoid fossa. That means if this line is perfectly intact, the humeral head is always centered into the glenoid fossa. That is because this is a direct connection which act to the superior labrum and superior glenohumeral ligament. From this, that is because this is a direct connection between the supraglenoid tubercle and the superior labrum. So you can see that this connection will help in centering the humeral head into the glenoid fossa, so that the fossa, the humeral head do not go in any other direction, is always centered in a perfect place. This is like a rod which is in fact running like this to center that one. Okay? So the long head of biceps brachii act as a centering mechanism or a centering force of humeral head into the glenoid fossa. And as a result, it prevents unnecessary superior, inferior, anterior, posterior translation. So that it prevents superior translation, inferior translation, anterior, posterior, or vertical translation and anterior, posterior translation. So that is the two significant role played by long head of biceps brachii, centering of the humeral head into, and at the same time preventing unnecessary translation. And finally, we see that it is attached to the capsule. It is attached to the labrum and the ligament. So it helps in the transmission of forces between the various ligaments in the glenohumeral joint. You know that there are capsular ligaments, superior glenohumeral ligament, middle glenohumeral ligament, inferior glenohumeral ligament. So this transmission of the tension between these ligaments is also a function by the long head of biceps brachii, and also it helps to tighten the loose superior capsule. You know that the capsule of the glenohumeral joint is not a tight one. It is loose in certain aspect. So this can be tightened by this long head of biceps brachii because it is acting through the center of the humeral head. So the functions of the long head of biceps brachii is a bit a confusing one, and it is not yet completely confirmed too, but we can confirm two things. One is centering of the humeral head and preventing unnecessary translation. The other function, that is transmission of forces between tension between different glenohumeral ligaments, and the second function which is debated is that it helps in tightening the superior capsule, are much debated one. Still, humeral head has the long head of biceps brachii has a role in the glenohumeral joint stabilization. Why its role is minimized is because it is affected by the position of elbow and the shoulder. So it cannot produce a great deal of force because of the active insufficiency of this muscle. So that is all about the cost dynamic stabilization, which is a vast topic, and I think that there is every possibility that you might be confused at the end of this video, contrary to other videos. So just revise this once again. So we can say that the dynamic stabilization at the shoulder joint is a function of prime movers, which is the deltoid, the prime mover muscles. Okay, the muscular forces that stabilizes it. The muscular force, that is rotator cuff, supraspinatus, and long head of biceps brachii. The force of gravity right? The geometry of the glenohumeral joint. For example, if the glenohumeral joint was slightly upward tilted, okay, it would have been more stabilizing in nature. The geometry of the glenoid fossa. And finally, various capsules and ligaments around this one. You can see that here the capsules and ligaments are related. So you can see finally we can arrive into conclusion. The dynamic stabilization is a result of 5 basic factors which include the prime mover or movers. Okay, that is a deltoid we are more focused on. The muscular forces which are stabilizing or muscular stabilizers. The force of gravity. You know that superior translation by supraspinatus is balanced by the gravity. The geometry of the glenohumeral joint. Any tilt in the glenoid fossa can ultimately affect the stabilization. And finally, various capsules and ligaments in and around the glenohumeral joint. That is all about this video. If you like the video, don't forget to click the like button and kindly subscribe to our channel.